The first three questions establish a pattern. Question 4 is mandatory. It's a question that every back patient must be asked. Since the start of your pain, has there been a change in your bowel and bladder function? This is the question that addresses the acute cauda equina syndrome, the only true surgical emergency in low back. The question is asked exactly like this: since the start of your pain. I'm not interested in this history with long-standing unrelated bowel or bladder problems. What I am interested in is a change in that function since the onset of the back attack, because these are the patients that have the potential to have a serious problem relating to bowel bladder. Acute cauda equina syndrome produces urinary retention followed by insensible overflow. The patient stops peeing for hours a day and then begins to dribble and not be aware. It produces fecal incontinence, not constipation, but the fact that they have lost control of their bowel and don't realize it's happened. Because the third component is a numbness in the perineal region, a numbness that alters the way they feel when they touch themselves. So these changes in the bowel and the bladder, retention, fecal incontinence, numbness, must be identified. If the patient says, there's been no change in my bowel bladder function since this problem started, then I am done. I don't have to question further. If the patient says, yes, since my back pain started, there has been a change, it is essential that I identify what that change is and rule out the possibility of a cauda equina problem. This is a mandatory question that's asked of every back patient, because this is the one red flag, the one true emergency that must never be missed.